Today, 1 in 150 individuals is diagnosed with autism, making it more common than pediatric cancer, diabetes, and AIDS combined. It occurs in all racial, ethnic, and social groups, but is 4 times more likely to strike boys than girls. In this video, you'll learn all about autism, its different forms, causes, and treatments. Autism is a broad term used to describe a group of brain disorders characterized by delays in the development of many basic skills. People who are autistic lack the ability to socialize or form relationships with others, as well as the ability to communicate. In order to understand autism, it's necessary to recognize the differences in brain function between typical and autistic brain development. The brain is full of neurons that send information to different parts of the brain. At the end of the neuron is a minuscule space where proteins and chemicals in the brain bridge the gap and make electrical connections, which then transmit the information to the correct part of the brain. These are called synapses. In the autistic brain, these synapses are mutated, which causes either over or underexpression of these signals, which in turn disrupts the sending and receiving of messages at synapses.
What happens then is that the normal process of neuronal pruning, in which the brain loses neurons that are not functioning, starts to really accelerate until, so when the kids are very young, they probably have 10 times as many synapses as you and I have in our brain. By the time they're about 10 years old, they have what you and I have now. And so during that early period, they have to learn pretty much everything they're going to learn, because at that time, the children can learn rapidly.
There are several different subcategories of autism, such as Rett syndrome, Asperger's syndrome, and childhood disintegration disorder. Rett syndrome is caused by gene mutation and usually only affects girls. Rett's is characterized by normal early development until sometime between 5 months and 4 years. That is followed by a loss of physical and mental growth. The first noticeable sign of Rett's disorder is slowed head growth, followed by loss of hand coordination and movement, replaced by repetitive hand wringing. Language development and social skills suffer from 2 to 3 years of age. Eventually, physical problems progress so that the child walks with difficulty, often stiffly with jerking movements. Asperger's syndrome is a developmental disorder in which people have severe difficulties understanding how to interact socially. They may not make eye contact when speaking with someone. They may have trouble using facial expressions and gestures and understanding body language. They also tend to have problems understanding language and context. Children with Asperger's syndrome usually have normal intelligence and language development, age-appropriate self-reliance, and interest in the world around, but lack the ability to interpret emotional affect. Childhood disintegration disorder, or CDD, is characterized by a loss of communication, cognitive, and verbal skills that occurs sometime between 2 and 4 years of age. Normal development is seen until then. The cause of CDD is not known. Symptoms include poor social skills, lack of bowel and bladder control, impaired language and motor skills, and difficulties developing relationships. The exact cause of these disorders is still unknown. However, recent studies suggest a strong genetic predisposition. Other factors may include certain types of infections, environmental factors, or disruption of early brain development in the uterus. Current studies of the brain suggest a strong link with a part of the brain called the fusiform face area. This section of the brain deals with visual recognition and interpretation of certain expressions on the human face.
Since the fusiform face area isn't functioning properly, the child is confused, it's uninterpreted, and that signal goes to the amygdala, which says, you better fight it or run away. And that, in a very simply put nutshell, is the theory right now.
Diagnosis of autism happens through a process of elimination. Once a parent notices developmental abnormalities, doctors may employ X-rays and blood tests to rule out a physical cause for the symptoms. Some early warning signs of autism happen developmentally when a child is around 2 years of age. Signs to look for are: when you point at something, does your child look at what you are pointing to? Does your child respond to their name when called? Is your child interested in playing with other children? Does your child seem unusually interested in repetitive motions or objects that have repetitive motions?
Toe walking, Hand flapping would be another thing. He didn't do much of that, but I know that there are children that do.
Any delay in language.
Any delay in language definitely would put up a red flag for me.
And I think the biggest thing is, you know, bring it up with your primary care physician the second you have a concern.
Most children are diagnosed with autism by the age of 3. Current research indicates that early diagnosis in the preschool years and enrollment in programs that focus on developing communication, social, and cognitive skills have been effective.
If you start very young, like 2.5 or 3, by the time they're 6 or 7, they can look pretty normal, and but it has to be intensive. So you got to start early, and treatment has to be intensive. So optimally, you want between 30 and 35 hours a week of one-to-one treatment.
If symptoms are diagnosed early enough, there is a strong possibility that cognitive and integrative therapies can help a child develop language and social skills. Here in Wisconsin, the Early Autism Project is working on the principles first developed by Dr. Ivar Lovaas of UCLA. Treatment methods focus on behavioral therapies that allow children to learn in new ways, thereby achieving a state of effective normalcy. Autistic children are able to catch up to their peers and have a chance at a fully integrated life. While these methods are not 100% effective in treating all children afflicted with autism, they do offer the most hope to families dealing with the disorder. If you would like to know more about autism or the Early Autism Project, log on to these informative websites.